Chronic abdominal pain, IBS. We know cannabis helps nausea, gives you the munchies. Today, we're going to talk all about it. Welcome back to Discover Marijuana. I'm Tim Pickett, here with Josh Fitzgerald, clinical pharmacist at Deseret Wellness. We're going to talk about IBS today and really abdominal pain, nausea, and cannabis, what cannabis can do, what it's not good for, how you can use cannabis to help your nausea and help IBS. Josh, I like this subject because I feel like we have something to provide patients when it comes to IBS.
Yeah.
When somebody comes in and their chief complaint is nausea or irritable bowel, Crohn's,
We've got
colitis,
options.
what are the good options?
Yeah, so we've got plenty of options. So we talk to people about this all the time here at Deseret Wellness. We have a lot of patients that deal with this. There's different options. There's anything from vape carts to edibles to tinctures, flour. It all works well for IBS. It's one of the great benefits with cannabis and IBS and most intestinal problems itself. We recommend always having a vape on hand to help with those immediate situations where you're going to have some pain and abdominal pain and relax those muscles and kind of alleviate some of the inflammation in your intestinal tract. Having a good edible on hand for nighttime use and even daytime use if you need it to take some of that inflammation out of your intestinal tract, great option too. Tinctures, good option also.
Is cannabis helping the condition or is it just treating the symptoms?
Both.
Is there a difference?
The symptoms are a little bit different. Yeah, I would say we can treat both of them. So we have inflammation with IBS. It's an inflamed bowel and causing pain. If we can mitigate that inflammation there, it's going to help with the pain too. So we can also mask the pain with cannabis to help with the pain itself. So it's one of those nice disease states that cannabis works really well for.
Yeah. Does it help speed up like motility or slow down motility? Or does cannabis affect that?
Cannabis can affect motility in certain ways, but it mainly just kind of calms the intestinal tract it goes through. Now, when we talk about how cannabis works in the intestinal tract, it's an edible form usually. And so it's passing through the intestinal wall. And while it's there, it's the edible you've eaten is broken down, and those cannabinoids there are coating the stomach a little bit as it's pushing through. So it's taking that inflammation out. So we can really pinpoint that treatment.
Do you find that you're recommending products with specific cannabinoids like CBG for inflammation?
Yes, but also we're looking at like Delta-8 for a lot of our patients too. With the nausea that's produced in a lot of intestinal problems, Delta-8 is a great option to go through.
We're doing an entire video on Delta-8 with Blake Smith, our bioanalytical chemist.
And he went into it, yes.
Yeah, and he really went into that. So watch that video if you want an in-depth discussion about Delta-8. It's a really good compound for abdominal issues and really peripheral issues. Why, we talk about Delta-9, but Delta-9 is the product that gets us high, right? So does Delta-8 not have as much effect?
Doesn't have that same effect, so it doesn't give you the psychoactive feelings that Delta-9 does. And so we can increase those Delta-8 levels a little bit more because it doesn't tip into the psychoactive effects, and we get more of a benefit from those increased doses.
So you're recommending patients can increase their dosing, which increases their symptom relief.
Right.
But they're not getting as high because they don't have as much Delta-9 on board.
Yep.
That's pretty awesome.
Yeah, and in IBS, we need to have those higher doses in that intestinal tract to help with some of these issues.
Do you recommend certain strain or certain strain types, sativa, indica, hybrid?
With IBS, no. You want to just make sure that you have something that's going to work well for you at the appropriate time. But I would say we do have specific gummies that I would recommend every single time that have Delta-8 in them, or using a tincture that has Delta-8 in it, just because we need that Delta-8 to get into that area and work in the intestinal tract.
So look for products that have Delta-8, CBG for inflammation.
Definitely CBG, yes.
CBD, which we kind of recommend for everything.
Yeah.
Right?
It's multi-purpose.
It is kind of multi-purpose. It kind of fits into all the receptors. It works better with THC. All of these things work better with a little Delta-9. And of course, we feel a little better with a little Delta-9 on board.
Definitely.
Keeping that dose and that temperature low again, you think?
You're going to get more of the CBG and CBN and some of the other anti-inflammatory properties that the minor cannabinoids have We don't need the Delta 9 necessarily at the end of the spectrum, but it could be useful every once in a while. You know, if you need that extra pain relief, you can go up on your temperature.
Mhm.
I wouldn't say no to that for sure.
Sure. Do you have a favorite strain or favorite product other than you were talking about the gummies with the Delta 8 in them? Do you have an inhaled product that you tend to recommend more than another?
So a lot of the products from Zion Pharmaceutical that have the Delta 9 in them, or excuse me,
The Delta 8.
Delta 8
Yeah.
in them. Yeah, most of Zion's flowers, they do have it in there, and you can talk to the pharmacist about that. Specific ones, maybe some of the Kush ones do have a little bit more anti-inflammatory properties to them. But honestly, like in my opinion, it doesn't matter all that much per strain when you're talking about IBS.
Really personal. Again, keep a journal.
Yes.
Keep track of what you're using.
Yep.
Delta 8, really good for nausea, really good for the abdominal cramping.
Yep.
Not going to cause a lot of psychoactivity because it's more peripheral absorption. If you have IBS and you want to comment below about a strain or a product that you've used that has really helped, we want to hear about it. As far as tips and tricks go, Josh, it sounds to me like this is very personal. Keeping with the Delta 8, trying to keep other cannabinoids in the mix,
And mix in some Delta 9 for sure.
and Delta 9 as needed, so to speak.
Yep, for the
The
pain.
long acting with the edibles and the tinctures
Yeah.
it seems to help,
Yes.
especially if you have problems at night,
Yeah.
like you said, because they act a long time. Make sure that you're talking to your medical provider, keeping them involved. They're going to really help. And the pharmacist, in this case, with IBS, you're going to be back to the pharmacy, trying different products, see what new is coming to the pharmacy. Josh is a great resource when you need help with new strain types and new products to try.